Sophie, thank you. Good evening. Welcome to Monday's Look North.
On tonight's programme, what's the future for emergency care in Kirklees and Calderdale? Tonight, Huddersfield has its say on plans to get rid of A&E in the town.
I can't say that anybody isn't going to come to harm because they've had to travel a little bit further. But what we do know is that people who travel further to a centre of excellence like we're planning, the outcomes are better.
And we'll be reporting live from inside that public meeting where hundreds of people have gathered to hear about those controversial changes to hospital care.
Also, our top story, hundreds of people are gathering in Huddersfield for a second public meeting into controversial changes to hospital services. The two hospitals are 5 miles apart and both currently offer a wide range of services.
But the Trust says this is unsustainable, with increasing pressures on their finances and difficulties meeting national standards of care. They're proposing to move all emergency care to Halifax, which would include A&E, intensive care and a new facility for very sick children.
Meanwhile, Huddersfield would become a centre for planned care, like routine surgery and diagnostics. The local NHS say the changes would improve outcomes, but campaigners warn that lives could be lost. Our health correspondent Jamie Coulson joins us now from Huddersfield. Jamie, what exactly is happening at the meeting right now?
Well, Harry, there are about 600 people who've made it into this public meeting. There are a further 300 outside who couldn't actually get in, so they're now protesting about some of the changes that are proposed to Huddersfield's A&E and other hospital services. Now, of course, much of the focus around all of this has so far focused on accident and emergency. So we've been to film down at the Huddersfield Royal Infirmary to find out exactly why it is that the local NHS believes change needs to happen.
Hello there, is it Paul? I'm Dr Davis, I'm one of the consultants.
Dr Mark Davis works as a senior A&E consultant at the Huddersfield Royal Infirmary and Calderdale Royal Hospital. He's one of the chief architects behind the plan to move all emergency care, including A&E, to Halifax.
The service that we're providing at the moment on two sites, while as safe as we can do, isn't as safe as we'd like to, and is not as high quality as we'd like to.
The two emergency departments currently provide a wide range of care, but they're struggling. They have half the recommended number of consultants and don't meet some national standards for children's or intensive care. So the plan is to centralise all emergency care on one site in Halifax, a decision that was ultimately taken because it will cost less than doing it in Huddersfield.
On one hand, if it would make things better, a better service, yeah. But I still feel that Huddersfield should still have its own A&E because it's quite a populated area.
Under the plans, the A&E would move to Halifax, but both sites would develop urgent care centres to deal with non-life-threatening injuries. And to give you an idea, here today around half the number of patients who've been treated could have been seen in one of those centres. Thousands of people have already protested through the streets of Huddersfield against the plans. Campaigners like Helen Kingston are concerned about increased travel times and the potential for one A&E to be overwhelmed.
Somebody's going to die. We shouldn't have to fight for healthcare on our doorstep. If you have an accident, the last thing you should be worrying about is how far away an emergency department is.
I can't say that anybody isn't going to come to harm because they've had to travel a little bit further. But what we do know is that people who travel further to a centre of excellence like we're planning, the outcomes are better.
Okay, thanks very much.
All right, no problem, you're welcome. Okay.
Thank you.
The changes to A&E remain controversial and are likely to be hotly debated at tonight's public meeting.
So what are you hearing now, Jamie?
Well, we've just had a short presentation. We've just gone into the question and answer session. I think it's fair to say it's already been fairly lively. Lots of questions about the A&E, lots of questions about how the whole thing might be financed, and of course how a town the size of Huddersfield could be the one to lose all of its emergency care services. And as you can see, there are lots of murmurings going on after everything that members of the NHS are actually saying here. Now, a little bit before the meeting began, I spoke to the MP for Colne Valley, Jason McCartney, who also raised questions about whether this would be a genuine consultation.
I don't think we can stop what we're doing. We have made the case for why we need to change things, because our current hospitals are struggling and services are on, could potentially become unsafe. So we can't stop what we're doing.
Well, the big question here tonight is for the doctors on the clinical commissioning group to demonstrate this is a genuine consultation. So if they listen to all the people here, all the 60,000 plus that have signed the petition, listen to all the doctors and clinicians that are contacting me and telling me they're completely against these proposals to downgrade A&E at Huddersfield Run Infirmary, they will go away and think again. Is there a plan B? How on earth can we end up with Huddersfield, a growing university town, without a full A&E?
That's Jason McCartney. I think we know what public opinion would say about this, Jamie, but what happens next and when will there be a final decision, do you think?
Well, this is the final public meeting in all of this, but the public consultation itself will go on until the 21st of June. So there are lots more drop-in sessions where people can go along and find out a lot more about what the changes will actually mean for them. But in terms of what happens after this consultation, there'll be a period of reflection and analysis of what's all found out before a final decision is made in the autumn. But clearly, based on what we've been hearing tonight, there'll be lots of questions and lots more answers to be found about how this could be better for the people of Huddersfield.
Jamie, thanks for that. Not easy to do that with all that going on behind you. We'll bring you the very latest from that meeting and we'll have more reaction on the Late Look North tonight at 10 here on BBC One.